Hi, my name is Anthony Obu, and thank you for giving me the opportunity to share this project plan with you. Today, I'll be presenting our approach to enhancing the quality of care and support for patients with more challenging mental health needs. I want to emphasize from the very start that while this project is about strategies and systems, at the heart of it are people, our patients, and you, their families and carers. Your voices, concerns, and hopes are central to how we design and deliver safe and high quality care. Current challenges. Caring for people with complex or challenging mental health issues is never simple. Some of the challenges we face include episodes of aggression, self-harm, or resistance to care that place strain on staff and families. For example, a patient living with schizophrenia may experience frightening hallucinations or paranoia, leading to agitation. Individuals with personality disorders may sometimes engage in repeated self-harm, which is very distressing for both families and staff. Stigma and misunderstanding, which sometimes lead to patients being excluded from opportunities for recovery, staff burnout, high turnover, and at times a lack of specialized training for handling highly complex presentations. Limited communication between families and services, which can leave you feeling unheard or excluded from decision making. These barriers can make it difficult to deliver consistent, compassionate care, but recognizing them is the first step to improving. Needs assessment. When we ask patients and families what mattered most, a few themes came through clearly. You want to be listened and respected as partners in care. You want staff to treat your loved one, not just as diagnosis, but as a whole person. You want reassurance that safety is prioritized, but also that recovery and independence remain the ultimate goal. And finally, you want clear communication so you are not left in the dark during times of crisis. This project is built around those needs. Propose strategies. To respond, we propose a set of strategies. Enhanced staff training and development. Staff will receive ongoing training in trauma-informed care, de-escalation skills, and cultural competence. This ensures that when your loved one is distressed, whether that distress comes from paranoid thoughts, mood instability, or overwhelming anxiety, the response is safe, respectful, and personalized. Family and carer involvement. We hold regular family consultation meetings and create feedback channels so that your perspectives inform care planning. This also allows us to share progress and challenges openly. Multidisciplinary collaboration. Psychiatrists, nurses, occupational therapists, psychologists, and support workers will work more closely as a team, ensuring that patients benefit from every angle of expertise. Individualized care planning. Care plans will focus not only on risk management, but also on personal strengths, goals, and recovery pathways. For example, someone with schizophrenia might have a plan that balances safety monitoring with support to return to studies or hobbies once stable. Creating safe and supportive environments. Environmental changes such as calming spaces or sensory rooms can reduce agitation and promote recovery. Quality improvement strategies. To make sure these strategies translate into real change, we will use quality improvement methods such as regular audits and monitoring of incidents and patient outcomes. Reflective practice groups for staff where we learn from our difficult cases such as managing repeated self-harm rather than just reacting to them. Feedback loops with families so your insights directly shape adjustments. This way, improvements are not one-off changes but part of a continuous cycle. Risk assessment and mitigation. Of course, there are risks. Introducing new approaches can be unsettling at first. Staff may worry about workload and families may worry about whether promises will be kept. There are also risks of communication breakdowns during crisis. To manage this, we will conduct structured risk assessments for both patients and systems. We will ensure staff are supported with clear protocols and supervision. And we will build a culture where raising concerns early is encouraged, not discouraged. Timeline and implementation. This project will roll out in phases. First 3 months, staff training, establishing family forums, and setting up feedback mechanisms. Months 4 to 6, introduction of new care planning tools and environmental adjustments. Months 4 to 6, introduction of new care planning tools and environmental adjustments. Months 7 to 12, full integration of multidisciplinary collaboration with ongoing audits and evaluation. End of year 1, formal review with adjustments made in collaboration with families and staff. Reassurance and closing. I know that many of you may be wondering, would this really make a difference? Let me reassure you, this project is not about ticking boxes or producing reports. It's about building a culture where your loved ones are treated with dignity, where safety and compassion go hand in hand, and where your voices truly matter. Your concerns will not only be heard but acted upon. Your loved ones will not only be kept safe but supported to grow and recover. And together, staff, families, and patients will create an environment where quality care is not an aspiration but a daily reality. Thanks for listening to me.